smallbusinesstogrow.com. We're here today with Dr. Douglas Pacaccio of Advanced Foot and Ankle Surgeons. And some of you that have seen some of our other podcasts or webcasts or tuned into podcasts or whatever it might be, maybe asking, why are we bringing a doctor onto the program to chat about business? And I think we had a conversation before we started, Doug, that you're basically a business owner and a lot of people don't realize that. So kind of walk us through, what's your background?
My background is I double majored in undergrad at the University of Illinois. I got a degree in biology and a second bachelor's in philosophy. So I was kind of like a confused pre-law, pre-med person. And then started looking at my options. And then I went to Pacaccio Medical School and did my residency out east at Inova Fairfax Hospital and did a fellowship at Georgetown University in the plastic surgery department and the limb salvage department. While I was there, I also started a device company. So not just kind of learning the medicine piece of it, but also into the mechanical side of it. One of my good friends that I went to college with at University of Illinois is a mechanical engineer professor. And so we had kind of kept in touch as I was going through school. And when I was in my gross anatomy classes, he was sending me postdoctoral PhD theses. And one of his was on shape memory alloys. So he sent me over an NIH grant. And at the time I wasn't that far along in school. I didn't know what we were talking about, but I thought that the material was interesting. So I asked him to send me his thesis, and I read that and I thought, oh, that's pretty cool. This metal that we could kind of make it bend like a rubber band. And then I put it in my bookcase, forgot about it for a couple of years. And then as I started looking at what we call the Association for the Study of Internal Fixation, there's a big manual that came out of Switzerland in 1959. And I checked it out of the library and I read it from cover to cover. It took me about 6 months to read it because we always talk about in bone surgery, how we're supposed to fix bones, fractures, et cetera, and how bones heal. And we talk about all these principles, but I think very few people actually read it. So I read it, and I read that in the shadow of having read Ken's thesis. And so the light went off, and I started thinking about ways that we could engineer fasteners for bone that would be more active and more dynamic with the bone. And so that kind of started. So it was kind of two parallel paths. One, I was just sort of trying to learn surgery and learn limb salvage. And then the other path was branched off. While I was doing that, we were in the lab looking at ways to improve the way that we fixate bones. So there's two real hats that I wear. One was sort of inventor, device designer, and then the second one was just your run of the mill guy trying to get through residency, learn his craft, and then go out and practice. After I graduated residency, I worked for 2 other practices before I went out on my own. And my wife, who also does what I do, we got married and we went out and started our own practice. And that's kind of where the business side of things came in, because I had seen it from a bunch of different angles. And I'd always thought that I wanted to maybe own my own practice. It's funny, if you talk to my wife, she'll tell you she was totally afraid of owning her own practice. And I think a lot of people have that trepidation. And so it kind of took a bad experience with the second employer for us to realize that, the grass might not be greener on the other side, but we sure want to go check it out. So that's kind of how that happened. And that's
kind of that trepidation is, I think most people that have a job, whether it's medicine or anything else, they look at starting a business and it's something that maybe intrigues them, they're interested in, they want to give it a shot, but they're scared to death. And it doesn't matter, you could be working in an ice cream cone factory and considering how cool it would be to open your own ice cream cone factory, but you're just scared to death about doing it. So you guys, I mean, your path, degree work, medical school, the process to become a doctor was one thing, but then there probably wasn't much business training in medical school where they say, young doctors, here are the tools you need in your toolbox so that when you are done with your formal medical education, you can open your own practice. So you guys had worked for other practices and realized maybe there's a better way and maybe we can do it.
Right.
And you am I right? You didn't really have any business school training, correct?
No, no, not at all. I mean, you're correct in that I didn't really have any business school training. I mean, we had like a short blurb in med school about practice management. There are organizations dedicated for doctors in the practice management space, but essentially, exactly what you said. It doesn't matter if you're selling ice cream cones or wrenching cars or whatever. There's a calculation involved, and the calculation always became, uh, you know, in a very few situations, if you're working as a doctor for another doctor, or even not even for another doctor, but for an institution. I think this is more relevant for people who work for large organizations like hospitals and multi-specialty clinics and things. The thing that crossed my mind was I'm looking at my NPI number, which is called the National Provider Identification Number, and that's how doctors are able to submit bills and charges to insurance companies, specifically Medicare services like CMS, which is the big one. That's the government one. And then a lot of the private insurers like the Blue Cross Blue Shields of the world and United Healthcares, they sort of follow suit with CMS. So what happens is you get this identification number, and you have to have that number in order to legitimately be able to bill for medical services to these institutions. And so the equation that kind of went through my mind was, well, if I'm the guy who owns the practice and I run a smaller show, and a couple things, I can run it the way I want to run it. And two, I don't feel like I have to see more volume, more patients to not only make enough income with my identification number to support my salary, what I think I should be earning, but then also on top of that, when you have administration on top of you, where does their salary come from? So that's sort of what happens. And what doctors have done in the last 30 years is they've kind of given up that autonomy. And I think a large piece of it is because we've never really been trained in business management and practice management and how to run businesses. Now, obviously, there's a lot of doctors out there that are great business owners, and they have done this. And I think they've done it the way I've done it, where they've kind of had that light go off and say, if I'm going to work 70 hours a week or 80 hours a week, at least I want to be doing it for myself. And there's good small practices where, like my associates, if they earn what I earn, they get to take home darn near close what I make, because I'm not really interested in making a lot of money off of somebody else. And because I still am in the swing of it, I want to do a lot of the stuff because I do a lot of consulting on the side. And in order to be relevant in that space, you have to be busy and you have to be doing what you're talking about. So there's no sign for me to slow down in terms of the clinical side of things. But when you just shift that other hat and you look at the business side of things, I just saw this big gap or this big arbitrage that if I go work for somebody else, they're going to tell me how to do it. They're going to tell me when I can and can't take off. They're going to tell me what I can and can't do in terms of how I deliver care. And they're going to be very interested in how much I'm producing. And a lot of times that boils down to volume. I have a lot of friends who sold their practices to hospitals or large organizations or private equity firms. And overnight they tell me, well, at first it seemed like a great idea, but then what happens is you're technically, you're owned. And now you got these people coming in with MBAs telling you, you're spending too much time with your patients. You're not seeing enough patients. You're not doing this or doing that, cutting overhead. There's just different ways that these systems are set up to maximize squeezing the pennies out of the day. And if you want to do that, that's fine. But for me, that just wasn't for me. I just kind of said, I can see fewer patients, spend more time with them, and try to provide better care and still make the same money that I would in another institution. And that really became clear to me about 7-8 years ago. One of our friends was working for a big group, and she wanted to leave. And so she got hooked up with us and we started talking about potentially bringing her into our practice. And she kind of told me what her collection numbers were and what she was being paid. And it blew me away. It blew me away. I said, wow, you're working, you're collecting as much as I am, but you're making less. And it was because there's this big system that has this giant overhead that has to be serviced. And the only way the money comes into the system is when a doctor orders a test, or when a doctor performs a surgery, when a doctor does an office visit. Nobody can go in and get an MRI, or a CAT scan, or an arterial Doppler test without that provider sending the order down. So that dilutes the whole process. And the thing is, the upside of it is you got people who say, well, look, I don't care about that. I don't want to deal with human resources. I don't want to deal with insurance companies. I don't want to deal with a landlord. I don't want to deal with negotiating contracts. And so there's, I'm not saying that my way is the only right way. I'm just saying that there's the distinct difference between the two. And some people just want to show up, be told what to do their job, be a good doctor, and go home at the end of the day and not worry about anything else. And I think for some people, that's where it needs to be. And I used to think, when I got out of residency, that when I went into the couple practices that I went into, I thought, well, man, I'm never gonna, if I have my own practice one day, I'm never gonna like treat my associates this way. Like, I'm not gonna overwork them and scut them out and things like that. And what I learned is that not everybody's like me. Not everybody wants to be a business owner. Not everybody has that mindset. So there are a group of people, especially as physicians, that just want to go and just show up and work for someone else. I have a friend, he's a really, really top shelf veterinarian. I mean, he's a really smart guy. And I asked him years ago, I said, why don't you just go out and start your own practice? And he just told me, I don't want to deal with it. I don't want to do that stuff. And that was his mindset. And so there are people who are like that. I guess this talk and what you're doing on your podcast is probably not for people who know they're that person. Your talks and your podcast is going to be for people who are thinking about making the jump, or thinking about starting a business, but they're not really quite sure if they're the right person for it, or if they're doing the right thing. And I think that's where this podcast,
or they've jumped, they've made the jump, they've decided they want to be this thing called an entrepreneur or small business owner. And like most of us that have started a business, you kind of get hit over the head, right? You're in your case, it's the practice of medicine. That's the service that's being sold and delivered. But once you go from being a doctor working for someone else, now you have that good or service to deliver, which is medicine. And then you have everything that comes with it, which you kind of mentioned, the things people don't want to deal with. They don't want to deal with HR. They don't want to deal with negotiating contracts, whether they're vendor agreements or their sales agreements, or that it's renegotiating a lease with a landlord, or looking at buying property, or if you own the business, having to maintain the HVAC and the roof and the parking lot and snow removal if you're in the Midwest or the northern part of the country, all of that stuff. And those are the things people don't think about. What I think is interesting with medicine is there's very little that I'm aware of attention paid to, hey, listen, if you're going to be a doctor and you're going to be in practice for yourself, you need to have this business skill set. It's not like you're not just going to own this business and only practice medicine. If you're the owner, you're going to have all of the other stuff.
Right. Yeah. I think I saw one of your most recent podcasts. One of your guests said, a lot of people they'll buy into a business, something. And I think his words were almost exactly like, you can't buy yourself a job. Right. And I think that that's very true, because if you think you're going to be the business owner and everybody else is going to do all the hard work for you, because you're the owner, that's an upside down way of looking at it, because successful businesses almost never run that way. When I was in college, I used to do this, it was like called the college painters, or it was one of those things where these groups would go around and and I had painted, I grew up in a trade heavy blue collar family. And so a lot of the trades were sort of in my background growing up. And I had done a lot of painting on the North Shore with my uncle. And so I was very familiar with it and how to do it, and wasn't too bad at it. And so when you were in college, these groups come and they say, oh, look, we're going to recruit you. And you go around and you basically sell paintings, or house paintings over the summer. And they had a little bit of a business training. So even before med school, I guess I should say, I did have some business training. I think I answered your question incorrectly. We didn't focus very much on business in school at all, especially not in residency. Residency is your time to learn your craft, to learn the medicine side of things. You do get guys who will talk to you and say, hey, if you think residency is hard, wait wait till you work, wait till you get out and actually you're responsible for everything that you're doing here, which is true. But the big thing was, I do remember I'd had a successful run one summer by going around and knocking on doors and saying, hey, you look like your house needs to be painted, which was kind of a funny thing, but you'd get some fun reactions from people when you tell them that their house isn't being kept up. But a lot of people would say, okay, yeah, give me a bid. And because, we're a bunch of college guys, we were probably really competitive with a lot of the bids. But the big thing they taught us was it doesn't matter how much you sell, you got to produce it, right? And I did a good amount of business, and I got to become like a regional guy who then was like had guys under me who were doing what I'd done the previous summer. And I had a couple guys who thought, yeah, I'm going to sign up for this and I'm going to walk around and I'm going to sell, house paintings to people. And then I'm just going to sit around, I'm going to collect the money while my friends do all the work. And it absolutely does not function well that way. And those guys all struggle to have success. If you don't climb the ladder, if you don't hump the paint, if you don't scrape, if you don't do all the hard work, they're certainly not going to do it for you. And that's one of the big lessons I learned there, which was the big thing is if you work hard, not everybody around you will work hard, but some of them will see that and they'll respect you for that. If you don't work hard, nobody will around you will work hard. So that's kind of one of the things too, which is when you own your own business, you really do become responsible for every aspect of it. And it, as much as it's things people don't want to do, there's the flip side. I mean, there's obviously a lot of good things about having your own business. And that's what I try to teach people all the time. I was told growing up, work for yourself, work for yourself, work for yourself. And that's what I tell people. It doesn't matter if you're in medicine or selling ice cream cones. If you can work for yourself, and not everybody can, right? This is what we've established. And I think you have a lot of insight on that, right? Not everybody can do it, but if you are the person who can do it and you want to do it, there is an innumerable number of benefits that come with that. And in the long run, it pays off. But you have to have that certain mindset and a certain personality you want to do it.
Smallbusinesstogrow.com. If you'd like to learn more, subscribe to our channel, subscribe to our podcast, swing by our website. Lots of great information from other entrepreneurs, small business owners. Take their wheel, put it into your business, get rolling. No matter what it is you're doing, even if in your case you're a doctor working for one of the big health systems, you still got to go to work. And some people that think they want to get into entrepreneurship, it's kind of like you said, they think they're just buying this high paying opportunity where they're going to just make a lot of money and they're not going to do much. And it doesn't work that way. It's you have an office, you have staff, and at the end of the day, that medical billing code that you have, when that gets submitted to insurance, that pays you, but then it also pays the person answering your phones, and it buys the toilet paper that somebody has to make sure you have for your bathrooms. Like all these other things happen. Like somebody as a business owner, someone needs to make sure there's paper towels and soap in the restroom at all times, and somebody needs to make the money that pays for that stuff. And it's typically not going to come out of the profits the employees, depending on what the business is, generate. That's going to, if you're the business owner, that comes out of what you made. So you better make sure you're making something.
Oh, for sure. And just a point of clarity, I don't think you were saying or suggesting to whoever's listening to this that I work for a large corporate hospital entity. I am on staff at a large corporate hospital entity as a private practitioner, but I'm not employed by them. I think what you were saying, right, Ray, is that people who are employed by these big medical corporations can feel that way, right? Because I just wanted to make sure that
yeah, I'm not saying no, you're in private practice. Doug, right. For those that don't know, Doug owns his own practice in business, and he does not work for a large medical group. But there's people that if you just right. want to practice medicine and you don't want to worry about if we have enough toilet paper for the public restroom, and we don't want to worry about if there's hand soap in the restroom, and if there's not, when are we going to have time to go buy some, or who's ordering it, and where's the corporate credit card, and who has access. If you don't want to deal with those things, you should have a job. And in medicine, you can have a job in a health system and just do the medicine piece, and you don't have to do all the operations stuff. Someone else does.
Right. And like I said, I mean, there's not, my way isn't the only way. And because this has worked for me in my life doesn't mean that everybody should do it. If I would never tell somebody, that they have to work for themselves or they're not doing it right. I mean, it depends on what you want out of life. There's a big thing called work-life balance. Yeah, I have a friend of mine who he also owns his own practice. We talk about this all the time. We talk about how much we're working and whether we're engaging in that work-life balance, because you can get caught up and you can start to lose sight of that, especially when you get hyper-focused on running your business, especially when it's a medical practice where not only do you have to worry about the soap and the toilet paper, but you're also constantly on call for at any hour of the night. When I decided to go into medicine, one of my friends who was a doctor said, when you choose to do this, you realize that you're giving up a huge chunk of your personal privacy and personal life to other people, because when they need you, it's not necessarily going to be convenient for you. Sickness and illness and injuries don't take holidays, vacations, and weekends off. So that's something that comes with that on top of it. And not everybody wants to do that. I'm certainly happy to share with what I think the benefits are. I mean, there's obviously trade-offs. Dealing with the stuff in terms of the things that people don't want to deal with when they just want to be an employee. There's the things that are good about dealing with those things, because there's the other side of that, which is you can make your own schedule. You can create the image you want. You can brand it the way you want it. You can provide the services you want. No one's telling you you're spending too much time with your patients. No one's telling you can't use this particular product because the margins aren't good enough on it. Excuse me. So
from that standpoint, I think that a lot of times too, people that go into business, oftentimes it's, well, I can make more money. I can do this for myself and I can make more money. And that may or may not always be true, but I think the bigger lesson that is often learned, and maybe share a little bit about this from your perspective, it's, yes, you can probably make more money, but you get all of these other things, whether it's, in your case, you can decide, hey, this is the hardware I'm using in surgery because it's the best and it's going to provide the best outcome. And you're in control of that, instead of being told just do this.
Not so much in the operating room. We do have to make the argument to the hospital who ends up paying for that hardware, but in my office, most definitely.
Right. Speak in terms of the office. I mean,
yeah. I use a particular type of skin graft for people who have wounds, and it's not cheap at all. As a matter of fact, our margins on it are barely break even most of the time. And so it's one of those things that a lot of private practices will shy away from. And a lot of the big medical groups will not even allow their physicians to use it because they see this big overhead item. But the product is quite impressive. And I've actually been able to heal surgical wounds and diabetic ulcers and things like that on people who had been to multiple other wound care centers who were not doing these things. And I think a lot of times it's because of the cost. But what I do is I just create a separate accounting, and I just keep anything that we get from those that goes into a separate bucket. So it doesn't even factor into my EBITDA or how the financial health of my practice is. And it just takes an enormous amount of paying attention to that, because you can get underwater really, really quickly with some of those high overhead items. But the best part is I get these really good outcomes. I get these patients who, I mean, if you can imagine like waking up every day with like an ulcer on your leg or something, these patients they go sometimes for years without any resolution. And then you introduce them to this product that, maybe I don't want to cast stones at a straw man, but I can tell you there are some very specific instances where I know for a fact that they weren't being offered that because of the cost and because there was a system set up that wouldn't allow the provider to use something with that high of an overhead. And we got them healed, and the gratitude is amazing. And that's totally worth it. I mean, in the end, that's what it's all about. And so when you get to do things like that because you're passionate about what your service is, and you don't have someone telling you can't use this best in class product because it doesn't fit the numbers crunching model, that's the upside to it. And it's a big upside, because in the end, it allows you to distinguish yourself in your market. And that's one of the things with medicine that's becoming less and less, right? Because nowadays you have, in a way, and I mean, I don't want to get in any trouble, but I'm going to tell you the truth, which is a lot of ways nowadays, if you have a healthcare provider that's in a big system and you need a specialist, you're going to go to the specialist that's in that system. You're not necessarily going to go to who the best specialist is. And I don't think that that's saying anything earth shattering or anything like that. I think if you took 10 doctors of any specialty across the country, you'd probably be able to rank them in terms of bedside manner, outcome, skill set. If you were able to kind of factor in all these metrics, and there's going to be a ranking order. They're not all going to be 10 at number one. There might be one really, really bad one, three really, really good ones, 6 in the middle. You don't really know. But the point is when I first started this out, most people were in private practice, and we've then brought our business to the hospital systems. And what would happen is the community of private practitioners would start to get to know who the good guys were, like who were the guys that the patients would come back and say, hey, I had a good experience with that doctor. They have good outcomes, that they really like that. And so the better guys sort of seem to rise to the top and get the referrals, and the business grows. Nowadays, it's pretty much you go and you get plugged into the system because that's where your insurance allows you to go. And then you're stuck with the team that they have, even though there might be someone up the street or down the block around the corner who's better suited for your particular problem. And it's not everything. I mean, every system has its good and bad. I tell people all the time, when you look at, this is kind of funny. I'll mention this. It's amazing to me how many people who have tough problems think they just need to go to the Mayo Clinic, right? And I'm not taking anything away from the Mayo Clinic, just like I wouldn't say, University of Chicago or University of Illinois or Northwestern. All of these institutions have, academic medicine. But what you find is, and cancer is a particular good example. If I always tell people, especially my family and friends, like if you're ever diagnosed with cancer and it's a really tough case or it's a really weird case, you don't just go to the Mayo Clinic, or you don't just go to Harvard, or you don't just go to the University of Chicago. So what tends to happen is some of these institutions, they kind of piece out, and some of them are better experts at certain types of cancers than others. And so you want to try to dig and find like where that specialist is, who's going to be the best person for that type of cancer. And there's definitely a time and a place for someone to go to institutional medicine for that when you're talking about some of that stuff that's cutting edge. But I have a really, really good friend who was the residency director at Loyola. And he told me, he said, yeah, he's like, it's funny because a lot of times these people come to us for a second opinion. And I'm like, well, I have nothing better to offer you than what your local guy was giving you. But there's that name above it, right? And so we live in a world now where that name above the door has more weight than individual relationships that the doctors have with their patients. And so it's just, for me to own my own business, I get to kind of control that piece, right? I get to control.
And I think that it's customer service, and it's, we're all in the service of others. And those of us that are in business, it's customer service. In your case, we call the customer patient.
Right.
And being a business owner, and we had the CEO of another business say this. They had said, in their case, they own the business, they have no debt, and the lack of debt and the fact that it's their business, they can decide. Every decision revolves around putting the best product in the market.
Absolutely.
And if it's not the best product, they're not going to do it. And in your case, you can make the decision, hey, there's a treatment option that is first or best in class, whatever we want to call it. It does cost more, but that customer service, the experience to the customer and the outcome is superior. So it's the right decision, instead of, well, within our system here, this isn't even an option because of cost or because of whatever. Well, now you can't put the best option in front of the customer because it's not even available. But because you're your own boss and you own the operation, you can decide this is worth the investment.
And that's kind of what happens in any entity that gets really, really big, right? I mean, your podcast is small business to grow, and everybody who has a small business wants to grow. But the $1 million question is, what's the right size? What's the right amount? And the example that I could use is, I have uh, I don't consider them competitors. I mean, there's other doctors in my area do the same thing that I do. And it was funny. I was walking out of the OR one day, and one of the guys that's up the street from me came into my operating room, and we were talking. And one of the reps said, "Oh my God, you talked to that doctor?" And I go, "Yeah, why?" He goes, like, oh, I would figure you guys were competitors. And I looked and I said, I don't have any competitors except for myself. You know, the service that I provide, the way that I make a patient feel when they come into my office, that's the competition, right? Because people are going to do what they want to do. I never want a patient to come to my office and feel obligated, you know, to have me be their doctor. To the point where even when you look at people come in and they've had multiple opinions, you see sometimes these people kind of get passed around an institution because they're kind of captured. They're stuck in this system. If somebody comes to me and I'm not the best person to take care of their problem, my mantra, and I'm the director of a surgical fellowship, so we do a 1-year postgraduate advanced surgical training fellowship for guys who had finished residency and want to learn some more advanced techniques. And one of the things I tell them all the time is be good at what you're good at, and don't try to be good at everything. Don't be everything to everybody. Just, you know, because if you start doing things you're not good at, you're going to muddy the waters and you're going to give yourself more headaches than it's worth. Patients love it when you refer them to somebody who can help them with their problem, because it shows them two things. A, bigger than being a surgeon, which is I try to teach my fellows, don't try to think of yourself as a surgeon. Think of yourself as a healer or a doctor. Surgery is one tool in our bag that we can use to help heal people, and how good you are at that matters. But at the same time, if that's all that matters to you, and that's all that you rest on your in terms of how you view yourself, you're going to miss the boat on a lot of other things. So if someone comes into my office as a private practitioner, I can send them to anybody that I want, regardless of what institution they work for. And I do that. I have patients that I'll send to the competitor who's the big hospital organization, because I know the guy inside there is what they need and it's who they want. And so I don't feel chained to any one type of referral pattern. And so I can take someone into my office, decide they need this type of specialist or this type of specialist, and I can tell them, you want to see this guy. And when I send people for neurology tests, when I send people for physical therapy, when I send people for second opinions, when I send people for a lot of times people in their legs the etiology of their pain will be coming from their back. I can tell them, this is the back guy. This is the guy that has the best reputation, and he's outside my system, but it doesn't matter to me, because I'm not trying to capture their dollars inside a bigger tent. I'm trying to make sure that they leave my office with a good experience, so that they walk out and they tell people, wow, that doctor really seems to have my best interest at heart. And that is the product, right? I had a guy come in yesterday who had a bad outcome with a total ankle joint replacement last December, and he had seen a couple of other doctors, and finally he saw a particular colleague of mine, and that colleague said, you know what, I know a guy that does this stuff, this isn't for me, and he sent him over. And the best part about it is, oh, Dr. So-and-so, he referred him to me, and he just loves this guy that referred him, because it showed that he's putting his ego aside, he's putting everything aside, and all he's doing is he's focusing on this patient and getting this patient better. And it's the same thing that we do. If we don't handle the problem, if in our practice we don't feel like we're the best person to handle the problem, we're going to push you to the person that is. And people remember that. And that's better than doing some kind of great surgery on somebody and fixing their problem, because it's more human.
And that's and from a business standpoint, we see that all the time with businesses we talk to, is they sometimes struggle and try and want to be kind of the jack of all trades in their industry. And it takes away from them being able to do the things they're really good at. And then the other thing is, it really hurts that long-term opportunity to have customer retention. So in your case, it's patient retention. And at the end of the day, there's dollars and cents involved, and there's a scoreboard, and that scoreboard is your P&L at the end of the year. And if you are doing right by the patient's going to have a better outcome, whether it's at your hands in the operating room, or it's at the hands of a physical therapist, or maybe a different surgeon. But at the end of the day, from a business standpoint, that retention of somebody that is going to sing your praises to their friends and family You can't spend enough advertising money to make that happen. But you can do it by just putting what the interest of the customer, or in your case, the patient, first.
The human side of it is huge, and it doesn't matter if it's I joke with my patients sometimes. I say, my next life, I'm going to sell candy and flowers, and everybody's going to walk up to me with a smile because they want to see me, and they're going to walk away from me with a smile because they're happy with what they purchased. What we do is a little bit different, and I have to realize that I can't fix everybody, and that was one of the things that in residency was a real hard lesson learned, because I'm a bit of an OCD type person, a fixer. And I remember my residence director had to sit down and say, "Listen, you got to understand, you're not going to fix everybody. You can't fix everybody. It doesn't matter." And what he kind of said to me, and I relay this nowadays, is like, it's not so much the failure of the physicians always. Sometimes it's that medical technology and medicine in general just hasn't caught up to that person's particular problem. And the example I use all the time is, we've always had the point mutation for type 1 diabetes, but before that was discovered, people had all of these complications of insulin resistance and not making insulin, and probably dying early and young. And we just didn't know why. Well, it wasn't so much that the doctors were failing, it's just that medicine didn't know what the problem was in order to fix it. And so, as much as we know today, and as much as medicine has come along today, there's still so much we don't know. And one of the big things for us is being okay with telling the patient, look, you do have a problem. I believe that you have a problem, but I'm not sure what it is. And maybe we don't have the medicine right now to discover that or to treat that. You can look at certain conditions, certain autoimmune conditions. When I was in medical school, almost 20 years ago, there were 3 types of Charcot-Marie-Tooth, which is a neurogenic disorder. It's a inherited neurogenic disorder. Now there's multiple types that the genomic tests can parse out. So things grow, and we get better and better all the time, but we're never going to catch up with all of the knowledge of the medical world. I just don't think that's at least.
And even from a business standpoint, there's a few things there. One, you won't be the doctor for every patient, because sometimes there's somebody better at it, and you have the independence because you're self-employed to send somebody to the right person instead of trying to do everything yourself. The other thing is, and we teach this with sales, is you will not have everybody as your customer. Some people will go somewhere else, and that's okay. And your time is better spent caring for the customers you have than trying to figure out why aren't they my customer. Needs to be spent doing that, but never at the expense of serving the people you already have.
Right. And I think, to be completely clear and honest, I would not be the right guy to talk to if someone was thinking about starting a small business and they want to talk about marketing strategies. I am not good at that at all. I got into practice, and I started practicing, and there was a need, and it slowly ramped up. And I just never, and I still don't really, I know that there's a return on investment. I know there's ways to do this stuff. And Ray, you talk to me about it all the time. But the answer I always give you is, look, my clinic days are full. My surgery schedule is full. It's as full as I want it to be. And I've always looked at that as, if I'm not making all this money to do marketing, to spend on marketing, which then brings in that need for volume, and I just focus on good care and slow down and spend more time with the patients, it can almost be a wash. And maybe that's true to some extent. Maybe it's not true to a certain extent. But the biggest thing that I would say that we're talking about right now is just, like you said, the service you provide. And in our world, in a medical world, the service we provide is our bedside manner, our actual empathy and caring for the patient's problem, the service of helping them get well. And one of my colleagues, Dr. Keith Goss, he had a great speech. He gave a talk at one of our meetings, and he talked about all of the work that he's done with the Navajo Nation, with Indian Health Services. And he talks about how some people are sick and they're not well and they have ailments, and they're not always coming to you to fix them, because some of them can't be fixed, but they just want, and he used the word, they just want someone to accompany them on their journey. And that was really powerful. That moved me a lot, because it made me realize, like, he articulated so much better what I had been trying to say to my fellows and residents for years, which is, if you show a genuine interest in the service you're providing, which the first thing is just try to be a healer. And even though we do surgery and I can take a arthritic joint, replace it with something mechanical and make that pain go away, it's not always that easy. And sometimes the healing starts with the psychological side of it. I've had plenty of patients who they come in really complicated problems, and I said, look, all I'm going to be able to do for you today is hopefully just provide you with some hope by talking to you about where you've been, where you want to go, what I think we can try to do to get you to that point or get you close. And it's amazing to me how powerful that is. Those people walk out and they just go, my God, like I think I found someone who's listening to me, who actually is invested in how I feel when I get out of bed in the morning. I had one lady who had I don't want to exaggerate. I want to say she had like 10 or 11 second opinions. And she came in and she had this really weird condition, and we got her better. And that's a different story. That's a more academic story. But I remember at the end of all this fancy limb salvage stuff we did, she said, the thing that really sold me is that when I left your office, I had hope. I actually felt like you were looking at me way deeper than just what was on my leg, on my ankle. She had a tumor growing out of her ankle. And I think that was the point that I'm making is, if you really care about people, they sense that, they'll feel it. And that's what sells. And that's really the marketing that you get. Like you said, it's this, you never want to send people out upset with you. I mean, you can't control that all the time. I don't know anybody who has never had any customer get upset with them, because you and I both know as business owners, you can do everything right. You could try to be so customer service oriented. There's no one doing it better, but you're always going to have that personality disorder, that narcissistic person walk through the door, and you're just never going to make it right for them, right? I mean, there's people like that out there, and I'd ask you, Ray, what's your strategy? How do you identify those people, and how do you deal with those people? Because I think for doctors, that's a big thing for us, is kind of not falling into that trap. And it usually, in my world, looks like someone who's so kind and so nice, as long as you're giving them everything they want. And the second you tell them no, or the second you tell them this isn't good for you, I won't do this because it's not the right thing to do, or whatever, they turn on you. And I think doctors have this desire to help people. So sometimes we give too much of the benefit of the doubt, and then we get trapped in a situation where we got this person kind of trying to manipulate us.
And that's where we see you can't worry about it. Jim Rohn is now he's passed on, but he was kind of a self-help motivational speaker guru. A lot of people don't know this, but Tony Robbins got his start in that world working for Jim. Jim has a number of bits that he does speaking wise, and he says, if the birds have flown into the other field, don't worry about them and why they're over there. Worry about the ones in your field. Take care of them. And I think there's, to your point, you're not gonna make everybody happy. And for people that own a business, there's a learning curve with that. It takes you a little while to realize that you're just not going to make everyone happy. However, if you have principles that guide your day-to-day operations, if you have principles that guide your patient care, which is always putting the best interest of the patient first, even if that means, hey, listen, there's another foot and ankle surgeon in your case that's better at this particular thing than I am. And yeah, I could do it, but I got to be honest, your outcome is going to be much better there, because this is what she does. This is all she does. She's good at it. Right. So I think if you have principles and you follow them, and you've kind of experienced a learning curve where you've accepted that you're not God, you're not perfect, and neither are your customers or your patients, and some of them aren't going to be happy. You can look at it and say, I've done everything in my power to do the best job, just like I have every other patient. And some folks just are never going to be happy, and then move on. Don't worry about it beyond that, because you're not going to change it.
Right.
And
I
that's,
I think that's good advice. It's just, I'll say this, and I don't know how many young doctors are going to listen to this, or but this can probably apply across the board for a lot of different businesses, which is, when I was first starting my practice, I remember I was so afraid of upsetting a patient, because I had this massive fear that they were going to run back and tell their primary care doctor that I'm some terrible person, that I almost sometimes let the patient drive the bus too much in the beginning, because I even though, well, do I really have to stay off of this for 8 weeks? Can we make it 6? Oh, well, and you feel like you're upsetting people. What I've learned over time is, uh, people in the end will judge you for their outcome, when it comes to that stuff. And I don't think it's any different for any other business, right? So how you get there, the outcome matters. The how you get there part does matter. In our world, it's a little different, because I tell my residents and fellows that if you let the patient dictate these things, you're going to get complications and problems that probably could have otherwise been avoided. And so I'm very clear now about people. And I have a patient right now who needs a custom printed bone part, replacement part. And this particular patient is very interesting, very smart person, but doing a little bit too much of their own research on it, and kind of telling me that I want it this way and that way. And I'm kind of saying, well, the truth of the matter is if you want that, then you're probably gonna have to find somebody else, because that's not how I do it. And I don't want to mix variables in, because then I can't really give you an honest expectation of what this procedure can do for you. And sometimes you just have to do that and let those people walk. I've had patients who want a ankle joint replacement, but they want to ride horses afterwards. And I tell them, well, I wouldn't recommend that. You're going to ruin the prosthesis. It's not built for that. You're going to get, and it's not that we're trying to be mean, right? We're just trying to give them what's best for them by saying, yeah, it sounds great that your ankle can keep moving, but the second you fall off that horse or you get caught in a stirrup and it dislocates that prosthesis, now you're in a true limb salvage situation. And I've lost patients to that, but that's okay. In the end, you kind of start to sift through those people, and then the people that you keep, the customers in the business world that you keep, are the ones that appreciate your services, and those are your best marketing tools, because they come back and they're coachable in a way.
And I think, and we see businesses, and we sometimes have to remind the owner, especially in a service environment, and even some that are selling retail goods, you have to remember that you're the expert, especially in the field of medicine. Not like the majority of your patients are not doctors. And if we let the customer, in your case, patient, sway things too much, well, we just compromise the outcome.
Right.
And we have to remember that in business, we should be the expert, or we shouldn't be in that business. And if you genuinely know what's right for your customer, and again, it goes back to your principles, as long as you're always putting the best interest of the customer first, you should be comfortable telling them, no, that's not right. This is the right way to do it. And then also you have to get comfortable, be okay with firing the occasional customer. I've got a friend that's in the business coaching and consulting space, and anybody that's ever seen him talk, or anybody that's hired him, he will say, sometimes you just have to get rid of that customer. They're not a good fit for you. And that's, in your space in medicine, there's some folks where if they're constantly going to be trying to dictate how the medicine is practiced and they're not a doctor, well, hey, listen, I don't want to not do what's best for you, so no. And you probably sometimes have to tell them to go somewhere else. And
yeah, and fortunately for me, in my experience, is that person is a very small percentage of the population of what I see. The flip side of that, though, and I think this is relevant to any business also, is some people do need some more, specialized, tailored, nuanced care. And the way you get that to them is you kind of got to put the doctor hat aside, and I'm the expert, I'm going to dictate everything here. And I mean, it almost sounds like I'm talking out of both sides of my face, but there's a nuance here, which is, you have a patient who, depending on what their needs are, what their lifestyle is, what their expectations are, you'll have to tweak that run-of-the-mill algorithm that you usually run on that particular problem. And I tell people all the time, if I have 5 patients on a stage with the same exact diagnosis, I might recommend, one treatment to 3 of them, and 2 totally different treatments to the other 2, because I've had enough conversations with them and I've gotten to know them that I know that this is what this person wants out of this treatment. And that's kind of when you talk about, like, surgery is a great example of this. When do you operate on somebody? Well, you got to kind of listen to the patient. And one of the things I always tell my patients every time, and this is something that's not this is not negotiable, and it doesn't move. It's measurable and it's consistent every time. Is I literally sit down and I draw out the procedure, and I walk them through the risks and benefits of what we're proposing to do. And the first thing I tell them is, look, my number one job here is to not allow you to make a bad decision. That doesn't mean that in this situation there's only two decisions to make, right? It's what I'm telling you, or not, or don't do it. Sometimes it's, we can do this, or this. And so you get three options, and then it's your job to explain to them, this is the risk of this particular procedure, this is the benefit of it, and then if you don't want to take that risk, you can do this and that. And so sometimes you have to have a visit with people a couple times to get to know them, to kind of know what they want out of things. And so it's not always just that I'm the expert and you have this particular problem, this is what we do for it. That might be the case 90% of the time, but you might actually have a patient who comes in who's just got a little bit of a different lifestyle, a little bit of a different expectation. And you'll never know that if you don't listen to them. You'll never know that if you don't hear what they're telling you. Because a lot of times when they talk to you, you can kind of understand what their problem is. And that's the biggest thing missing today too, is we as doctors get very reliant on technology. We have MRIs, we have ultrasounds, we have scans, we have all these amazing things that we can do to objectively help us parse out what the problem is. But when I see the cases that slip through the cracks, it's usually because the objective imaging wasn't picking it up, but we weren't listening to the patients, what they were telling us. And if you really take and pay attention to what people say to you, and this is true of any customer, right? If you listen deeply and intently to what these customers, and in my case, patients, are telling you, you'll start to, over time, start to gain a recognition of certain things, to the point where I could maybe be on the phone with somebody, and when 10 people who'd never met each other and live at different parts of the earth describe the same exact symptoms for me, and the MRI doesn't show anything, well, then I know, that when you hear those symptoms and you start to discover what those problems are, just by listening to what's happening, like when the pain happens and how it happens and what it feels like and what makes it better, when you listen very closely to that stuff, sometimes you can make the diagnosis just by listening. And it takes that's a culmination of years and years and years of hearing people say the same thing, describing the symptom the same way, or very close to the same way, because these things present very similarly when it's the same problem. But if you don't listen to your customer, if you don't listen intently to what they're telling you, you can miss those things. And I think when you're selling something, or if you're selling a widget and you want feedback from your customers, and you want honest feedback from your customers, do you want to sell somebody something just to make some money off of them, and you don't care if it's what they really want? Or do you want to have a win-win where you sold somebody something that they really want, something that they really like, and something that they're really glad they purchased from you? I mean, to me, that's a better route, right?
And that gives you, that's a long-term business play as well, is when you put the needs of the customer first. And part of that, and it's huge, and I have told business owners this, like, you have to slow down the sales process, and you need to find out face to face or over the phone from your customer what the problem really is, and then present the right solution for them. And sometimes, even if they want to buy something, like when I had my brick and mortar, I would have people come in and they would be, I want to buy a bunch of supplements. I don't care what it costs. I need to lose weight. Sell me everything I need. And that day, that moment in time, it was like I could go make the cash register ring, and I could hit their credit card for a few $100, and it would be a pretty good sale for that day or for that week, or it could make the month. But at the end of the day, is that really going to solve their problem? No, there's a much deeper conversation that needs to be had. And there's a lot of other things we need to do. And then we can talk about selling some of these products. But if you want to play the short game, you take their credit card, you sell them one of everything. If you want to play the long game, you put their needs first, you have a conversation, you dig deeper about what their problem actually is, and then you give them the right solution. And when you do that, you have, and you've heard me say this before, you have a wandering, walking billboard that's telling the world about you. And from an advertising and marketing standpoint, you can't buy that And there's a case to be made for advertising and marketing. And one of the cases for advertising and marketing is you can scale it. At some point, every time you put a dollar out there, 50 cents comes back. So you just keep spending more dollars and you keep getting the 50 cents, or $1.50 comes back. So you're making 50 cents on your dollar. But you can't scale the experience thing. But if you're playing the long game, the real ticket is to provide that wow experience, because that person's going to come back.
Oh,
and
I can't
and
agree
if they
more.
don't come back, they will tell somebody else to come in.
Right. And that's I think that's something that's measured across any business. And in my, like, an example in my world in medicine would be, and again, remember, we're just talking about giving people what they want, what they need, selling them a service. And in our world, in the doctor world, it's more than just medicine. And I think someone who sells widgets would tell you the same thing. It's not just about selling widgets. There's an experience attached to that. I just did surgery this morning on a lady from Dallas, and I'm not on social media at all. And I, for good or for bad, I mean, I know that this is the wave of the future, and you should be on Facebook. I think my practice is on Facebook. My wife kind of manages that, but I've never had a Facebook account. I've never had a Twitter account. I don't pay too much attention to social media. I feel like I actually said this years ago. I said I hope, like, when I'm 80, that, like, a study comes out where we can determine, like, maybe Facebook would publish, like, how many years the average person born in 1996 has spent on their, in the interfacing with their phone, their iPhone or their computer or something. How many years of your life did you spend just virtually living instead of really living? And I'm not judging it. I'm not saying anything more than that, but it's just not for me. It hasn't been for me. But it's funny because I was talking, I said, God, I forget, how did this lady find me? Right. And my partner said, oh, it was so and so. And so what it was a local patient here who we had helped, who had felt like they'd had a good experience. And these people talk. They're on social media. They're everywhere. So that is the walking billboard, right? You think of a billboard as, like, you drive by it when you're driving down the highway, but really the billboard now is every time you pick up your iPhone, every time you log into your computer, it's a billboard. I mean, this is, everybody's trying to grab your attention. And she found me because there's these patient websites about, people who are having complicated problems and things like that, and they talk and they talk and they talk. And to be honest with you, sometimes someone comes in with a problem that we're not going to fix 100% because the problem's so bad. And the example I use is, if a shark bites your arm off, we could sew it back on, but it's never going to function the way it did before it was bitten off. And there are problems in medicine that exist like that. There's a lot of problems that you can fix and they get better almost as good as new, but there's a lot of things that just don't. And sometimes these patients that are our biggest advocates are ones that have really, really bad problems, and we're never going to fix them 100%, but they can sense that we're trying really, really hard and we really, really care about them. And that's what turns that flashing billboard on, right? And that's what people want to see. They want that.
And
service.
That's a sales process technique that we teach to businesses, which is, that the lead, the prospect, the potential customer needs to know that you care. That's the first thing, because if they believe you care, they're going to trust you.
Right.
And that goes a long way to giving you an opportunity to actually close the deal and get the sale. In your case, it gives you the opportunity to have the patient. But I think what's huge, so for those that are watching or listening to this, we're in Northern Illinois. I'm in Northern Illinois, and so's Doug. So your practice is in Illinois, and then this patient is coming or came from Texas. Is that what you said?
Yes.
And that happened because you delivered a positive experience to somebody else, and they went and they're out sharing it everywhere.
Right.
And you were totally uninvolved. That was no result of any advertising or marketing you did. All you did was your job, and you took the time to do it well. And it produced more business.
I try.
Right.
I mean, that's the frustrating thing about what I do for a living. Is there's so many variables in every specimen we work on that it's not a physics equation. And so most people are very good people. Most people are very reasonable people. Most people understand that their bodies are what they are. Most people, I don't think, hold doctors to the you have to fix me at all costs. I don't want to do anything for myself. And most people understand that, especially people who get complicated problems, that it's not necessarily their physician who's not making it well. It's just that medicine itself doesn't have the answer, or their body just isn't cooperating. But when all of that happens, when you have that patient who's just extremely complicated, the thing that I've listened to over the years, and the things that I've heard, and this is kind of going back to that customer service thing, what a lot of them have in common is by the time they come to us, and if they have a good experience, and we try to make sure that most of them do, and we think we're doing a pretty good job with it. But what you tend to hear the theme over and over again is that the second they walk into another, let's just say another shop, and they start presenting this really complicated problem, a lot of times they get this like, oh, well, I don't want to deal with you. You're going to take up too much of my time, right? And then it's just boom, dismissed. And that's how a lot of them feel, is that they've been dismissed because they're either too complicated for the person they're seeing, or the person doesn't want to take an interest in their problem, or they're not getting the benefit of the doubt that they're not malingering or something like that. And so, the other thing is just give your customer the benefit of the doubt, even one that's angry, even the one that's upset. I've had patients tell me, doc, in confidentiality, like, here's something that I called and your staff did XYZ, or they said XYZ, or, I don't want to get anybody in trouble, but so-and-so forgot to call in my prescription or something like that, and it's like, and what I tell them is, listen, and some patients have trepidation about telling you that. They're like afraid to tell you because they don't want to seem like complainers. It's amazing how the world works. You have people who love to complain no matter what, and then you have people who just never want to be perceived as complaining about anything. And I tell them right there, like, well, thank you. I'm really glad you told me that, because if I don't know that that's happening, I can't fix it. And that's the other thing is, like, we're going to talk about like these business maxims that I would hold. And I know you're going to ask me for like 3 or 4 of them later. And a lot of this is kind of clinical, what we're talking about, but it does transfer over into any business, because I think what that is you always want to seek the truth. And that's kind of my number one, which is you want to seek the truth over being right. And what that means is you walk into your office or you walk into your practice and you have this image in your mind of what you want that brand to look like, what you want that entity to look and feel like. If you're more worried about being right all the time, that your ideas are correct and the way that you want it to be is the way that it should be, then you're going to miss out. You have to be open to the truth. And sometimes the truth is you're wrong about something. And that's what makes us better. And that's the thing that I think is absolutely imperative for a business to grow.
And that's that long play on
Exactly.
Business.
Yeah.
That's the long play, is because if you're willing to acknowledge that there's a different way, a better way, you were outright wrong, and you change gears, you can grow. And that's the same thing with employees complaining, which it's a complaint. Hey, your staff was supposed to do this and they didn't. It's a complaint. It's a well-warranted one. And it's also an opportunity. The fact that they were willing to share that, you can make it better. That's like, I got a car wash a couple weeks ago, in an automated car wash. So I paid my money. I pulled into the thing. My car got covered with soap. And then the car wash thought that the whole wash thing, so soap, rinse, dry, all of that had gone on, and the door opened up and it told me to pull out. So I contacted through Facebook the owner of the business, and I wasn't complaining. I could care less. I just happened to like this car wash, and I'm like, well, if they don't know about this and get it fixed, if enough people have this issue, they're not going to come here anymore. And this car wash is close to my house and I like it. So I messaged them through Facebook, and I messaged them, and then I pulled into one of the other wash bays and I rewashed the car and went on my way. Well, the guy texted me later, or messaged me later on, with a couple wash codes thanking me. It was kind of surprised that I took the time, and I told him, like, listen, there's some self-serving interest on my part here, and it's this easy. If you don't know about the problem, you're not going to get it fixed. And I want to see you stick around. You're close to my house. It does a good job. But those complaints,
That's exactly right. That's exactly
allow
right.
us to make a better business.
And there's another side. Well, there's a lot of examples of what you just said. I mean, an example is, up by my cabin, there's a little mom and pop convenience store, and everything there is more expensive than if you went to Walmart or wherever. So, let's say you go in there and the people are jerks and you don't like it and the service is terrible and the place is a dump, I mean, you're gonna be like, all right, well, I'll go to Walmart, right? But I think there's an element of these little businesses that survive on people recognizing that, hey, I want these guys to be here. I like that I can go in here. I
Yeah.
like that they know who I am. I like that they recognize me. I like that I have a relationship with them. And I'm willing to pay a little bit more for my eggs, right? I'm willing to pay a little bit more for this because the big box store is 15 minutes further down the road, and that's 30 minutes both ways, and it's worth my time and effort. And I just like the fact that I have options. And I think that just kind of goes back to like, we were talking about just like seeking truth over being right. It's like the whole saying, the definition of insanity is doing the same thing over and over again, expecting a different result. It's kind of like if we're like, well, we're just going to keep running into this brick wall, and one of these days it might turn into a door. That's you being stubborn and rigid in your thought process and not listening to the feedback you're being given. And so the big thing that I say about any of that stuff, right? And it's the guy with the car wash too. It's like, nobody expects these things to be perfect. And people who do expect all of these things to be perfect are kind of those types of people that we talked about earlier. They're probably never going to be happy with anything.
That's the customer you want to fire.
Right. And the thing about it is, and this is very important that I try to teach my fellows and residents, and I try to be this way as much as I can. It is okay. It is okay to be wrong. It is okay to make mistakes. When you get into a mindset, and we live in a world that's so tough on people, and it scrutinizes every little thing you do and say, right? And social media is kind of a big part of this. I think there's no shortage of documentaries or discussions about how social media changes people when you can be your ugliest version of yourself behind a computer screen, where you may not behave that same way if you're face to face with somebody, right? But the point that I make is everyone's so worried about being perfect or projecting this image of perfection that there's almost this perfection in understanding that you're imperfect, which makes it okay for you to look in the mirror and say, I was thinking about this the wrong way. It made sense at the time, but I now have more information. I've been able to process more that has changed how I feel about this. And that's true with our treatments all the time. I tell my patients, I don't do things the same way in 2021 everything the same way as I did in 2011. It's because we're constantly gaining more experiences. We're constantly getting more information and putting that information into the machine, and it's spitting out a different algorithm. And if you're not paying attention to that, you're going to get left behind. And that's true, I think, with anything. And we did this with our device business too. I tell people all the time. I mean, a lot of times, if you look at the business that we built up, I'm a founder and the surgeon inventor of Dynel, a company, a medical device business called MedShape. And we just sold the company to Donjo Orthopedics, a big global orthopedic company. And when I see in the device world, what I see is a lot of times people come out and they go, well, I have this widget and I know how to make this widget. So now I got to figure out how I can fit it into some sort of a market that I can monetize it, right? And we never did that. We basically sat down as a group and said, what are the problems? We have this platform of technology, right? So we have this technology platform that can do certain things in a broad sense, but how do we best apply that? And the first thing you do is you look for the problem. And I think of any business, you're looking for your market. And I think your last guest made a good point, or you and I were talking about this. If you have a dog store, a dog grooming shop, in a town of 500 people, you don't decide, well, I'm just going to do it better and set up your shop across the street and do the exact same thing. You might want to look at that and say, well, and it's one thing if you love dogs and you love dog grooming, I get it. But if you're looking to just kind of start a business, sometimes the easiest place to start is to figure out what's the problem that I'm solving, right? And in medicine, for us, it was, we wanted to try to solve this problem of non-unions and ankle fusions. And we said, this is a huge problem. And it wasn't a huge market in medicine, but it was a huge problem. And so you have to either do like the Ferrari model, which is you're going to sell a few cars, but they're Ferraris, or you can do, the Ford model. You can sell a bunch of cars that are not Ferraris. And so you can either have a huge market and have a small piece of that, or you can have a small market, but have a really good solution to that market. And so I think looking at that is important too. And so when you do that in this device business, we had ideas that we thought like this product really would make a nice this. And then we looked at it and we couldn't get it to work right, or it just wasn't a right fit, and you scrap it. And so that's kind of the thing I'm talking about, like being okay. It's okay to postulate something, be wrong about it, and change your mind. And that's true of anything in life. You can hold a certain position on something, but as life goes on, as the experience of life goes on, and as the experience of your business goes on, and as you get feedback more and more and more from your customers, in my case, patients, if you're listening to them and you're paying attention to them, and you're not always worried about being the right person in the room, but you want to know what the truth is, you're going to adapt much better, and you're going to actually come out ahead, and you're going to be in a better position in the long run.
I think there's so much to be learned by making mistakes. And I think a lot of times people are worried about being right and being perfect. I did a couple videos on perfect, and its impact on, basically it allows you or gives you reason to pause and procrastinate, because instead of executing, just getting things done, there's always this, well, I could do this slightly better. And that leads to inaction. And it also leads to clinging to ideas or clinging to business practices that are wrong. But the other thing is, how much, if you look at your practice, and we're going to talk devices in a second, if you look at your practice, you've already established you went to med school, you double majored at the bachelor level in college. Nowhere did you say you went to school for business. And if you look at your practice today in 2021 versus when you started, how many things did you do wrong? And because of it, you arrived at the right way to do the business. And if you didn't make those mistakes, you wouldn't learn the right way. That's the tuition.
Think about it this way. You think about the efficiency of how you run your business, or your life for that matter. Just look at like a 1-year-old kid, right? And one of the toys that they get, and I watched this when my kids were younger, what do we give them? We give them that little block that has the star and the triangle and the circle and the rhomboid and all those things. And I mean, if you really think about what's happening there, right, is their brain is looking at this, and it knows that it wants to put these pieces inside this box, but they're gonna try to put the circle in the square, and it's not gonna fit. And they're gonna try to put the rhomboid in the triangle, it's not gonna fit. And so time and time again, they're making the wrong choice, right? But the amazing thing about the human mind is that every time that experience doesn't turn out the way they want it to turn out, it gets recorded. And it says, okay, this is not the right way to do it. And I had a joke in residency because, we had some really, really fantastic surgeons as our attendings. And then we had some guys that were not very good. And I think that's unfortunate to say. And I know people who put a lot of faith and trust in doctors don't ever want to hear that. But the reality is, not every doctor is the best in his field. I'm sorry to say, just like not every car mechanic is the best in his field. I don't think there's anything earth shattering about that revelation. But there was a guy in my residency, and I won't even come close to naming names because that's not the point. The point is this guy would say, well, the patient, wants me to do everything because, I got 30 years of experience, right? And I remember going, well, if you're doing it for 30 years, that doesn't make you good at it. You could be doing it wrong for 30 years, and all you've been doing is doing it wrong for 30 years, right? So always be willing to learn, to adapt to those mistakes. Try to ask yourself every time, is there a better way to do this? I'm constantly doing that in my field. Every time I'm looking at something and saying, is there a better way to do this? Is there a way we can produce a better outcome? Is there a way that we can make it easier for the surgeon and the patient? Is there a way that we can make it more efficient, save OR time? And if you ask yourself that question every time you look at something, you're going to have some light bulb moments, and those are going to be at some point, going to be good breakthroughs for your business.
I think that.
Yeah.
Go ahead.
No, go ahead.
And I think that really is how you start moving forward. That's where you start to have opportunities business-wise to make real money. And also along with that, sometimes that means you have to invest money. It might be redoing something you've already done, spending more money, or like you mentioned the wound care before, it might mean that you spend the money on the premium top shelf solution, and short term that might put a bigger number on the expense column of the business ledger, but long term those positive outcomes are going to do a lot more in favor of growing the business than not. It's a good investment, and And I'm mentioning this because sometimes business owners look at it and they're like, well, yeah, I probably should change, but I don't want to spend the money. But really, if you're thinking you should change, you should spend the money because it's going to allow you to do a better job at whatever it is your business does.
Right. That kind of dovetails into my second, I kind of have four top threes for you, but my second one is, if you put the service or the product over the money, good things will happen. And we have a saying, or I have a saying, and I'm not the only one. I don't think I coined this term, but I definitely repeat it a lot. And I try to teach this to my pupils, is good medicine is good business. Right. And so, if you want to sell cars, if you make a good car, you're going to sell cars. If you want to sell supplements, you make a good supplement, you're gonna sell supplements. There's another side of that coin, and I always like to think of like the pros and the cons, or the yin and yang of everything. In nature we have this as well, which is, as you're growing your business, if you're putting the product ahead of the money shows up. And I had a really good attending at Georgetown. I said, hey, I did, like, in my time in residency, I had been a part of and performed about 3,000 surgeries. Okay. And so I had this like skill set, and I was like, okay, I felt really confident. Like, I know how to do this. I know how to do surgery. I know how to technically perform this. And I said to my attending, I asked him when I was at my graduation, I said, well, what's next for me? Like, how do I go out and how do I turn this into a lifestyle? How do I turn this into a living, this, finite, very specific skill set? And he had very, very simple words. And he said, Doug, he said, all you do is you give people what they need, and the rest will fall in place. Right. And I think what he was saying in a shorter sentence was, if you practice good medicine, the money will follow. And that was sort of the nice thing about when, and I really felt this, and this is not just a saying, like a cliche. My wife would tell you the same thing. When we left the practice that we were working for, where we were being told how to do everything, because we were being told by a guy with an MBA who was the practice manager, who was looking at a spreadsheet every night, looking at numbers. And my practice before that, which was like, how many gastroc recessions did you do last month? And how many are you going to do this month? We'd get these questions all the time, like, sort of, what's your plan to do more of this? And my answer was always, I'm going to do what the patient needs, because that was the advice I got that really impressed upon me at Georgetown. And I just knew deep down that if I did that and I stuck with it long enough, eventually that would bear fruit. And it did. In my practice, like I said, I don't spend any money on marketing. And I'm as busy as I want to be. There's other challenges to having a medical practice, and there's other challenges to being a doctor. But when it comes to, filling the docket with a clinic day, it's not that difficult. And I think it's because of that saying, good medicine is good business. And you can swap those words out with anything, right?
And you
have
to you got to allow time to happen. That's where making that long play,
right?
You're not gonna, it's spending the money. Going back to the wound care example, using the top shelf product is going to increase expenses in the short term, but it's going to give you a better long-term outcome. And those long-term outcomes need long-term. And a lot of times business owners look at it and they're like, well, I tuned into that podcast and that doctor dude told that other dude that, you got to take care of the customer. Good medicine's good business. Well, I did good today, yet I'm not, where's the money? Well, the money's going to come later. And you got to be patient. You got to allow that long term for the long play to play out. And it's not immediate. It's not immediate, but your proof, your pudding proves this. You're not spending money on marketing and advertising, yet you're as busy as you want to be.
Well, and I think I'm not nearly unique in that. I think, we're talking about it, but I think if you talk to any successful private practitioner, they would agree with that. I think that, I was talking to a guy one time, and he was telling me how his group, found this guy that had a struggling practice, and he wanted to join their group. And so they were like, okay, they let him join the group. And in so many words, he was basically, well, it didn't work out. And I said, well, that was your number one mistake. And he said, what are you talking about? I said, well, why would you recruit the guy that's got the struggling practice? right? I mean, there's something going on there. And why was he so quick to dump his practice to come and work with you? I said, don't, you know, there's some things are just, there's flags that are going up, right? I said, if you guys really want to grow, you need to go after the guy that really doesn't want to sell his practice to you. You know, you need to go after the guy that's content. That's the guy you're going to be happy with. And you might spend a little bit more money to get him, but in the long run, that he's going to provide that good medicine, which is in the long run the good business. The flip side of that, though, Ray, and I think it bears mentioning, is when you are running a small business, especially in maybe not especially in medicine, I see it through that lens, is there's a thing in nature called you know, risk benefit and work return. And the example is you know, a bird, right? It'll leave its nest and it'll fly a certain amount of distance to find food, whether it's an earthworm or a berry off a tree or something like that. But innately, these creatures understand that, you know, if you drive, you know, using a car as an example, right? If you drive, you know, 20 miles to get gas to save 2 cents a gallon, right? But then you got to drive all the way back, and in the end, you know, you burned up whatever it is you saved. You know, there's that analysis that always needs to be done as well. So a bird will not, you know, at some point, a bird will not leave the nest because the flight pattern or the distance that it has to go to get that earthworm per se, it's expending more energy than that earthworm is providing back, right? And business is the same way, which is sometimes you got to look at in medicine. For us, it was like we had to turn down some contracts because sometimes the payers, especially with some of these Medicare Advantage plans, they pay, they're the middleman, right? So the government pays these guys, they give them a lump of money, and they sell the patient this story that, oh, we're going to save you money. Well, the way they save it is they cut the doctor's fees, and then on top of it, this one particular plan, every time I saw somebody, they wanted to audit the chart for risk stratification. So it's something insurance companies do to collect data on people. And by the time my staff like printed and sent out the you know, received the request, printed out the chart, sent it out, you know, complied with all the laws involved in doing all of that, you know, you actually end up losing money when you see that patient. And so you sometimes, and I tell my young associates, my young doctors, like, sometimes you're literally better off sitting in your office twiddling your thumbs than you are seeing a patient or producing a business that is losing you money. Because it's better to be net zero at the end of the day than net -10. Right. And that's something that's hard to grasp sometimes because you think, oh, I just need more business, but the type of business you get matters as well.
It's huge. It's huge. And that's it there, that too, there's a learning curve where once you have enough experience to realize that, hey, not only are we going to get paid less by some of these plans, but when I look at the amount of time that we're going to put into it, it's a money loser, and I need to say no, and we're just not going to do that. And that comes from experience, and I think that people need to be aware of it. They need to pay attention, and you need to say no. Like, you can't do it if it's going to be at a cost. Like when I was a young engineer, which is what my actual background, my formal background is, I was on a project for Honda, and I would sit in these meetings and hear about Honda wanted another price reduction from the sales director. And one day I just raised my hand. I'm like, have you ever thought about telling them no? Because I've sat in these meetings now for months, and at some point, are we not going to be losing money by doing their work? And they did. They actually did go and say, we're not lowering the price again. But you have to be willing to do that, and you have to be willing to possibly lose customers. Like in your case, saying, you know, we're not going to accept that insurance. Right. That means you're not going to get those patients, but that's actually a good thing.
Right. And it's not good for them. I mean, we're very sympathetic to the fact that a lot of times these people are approached by a broker or somebody, and a lot of times the people are selling the product don't even understand the product. And you're dealing sometimes with, I mean, it doesn't even matter if you're elderly on Medicare. I mean, I could probably count on one hand or maybe if I'm lucky, both hands, how many people I know who fully have a full grasp of how health insurance works and how the healthcare system works in general. And that's a whole different podcast if you ever be interested in that. But it's just it's not that we don't want to see the patients, and we explain that to them. We say, look, you know, we love having you as a patient. It's just right now, and what amazed me is when I explained it to some of these patients, they were taken back by it, not angry at us, but like, oh man, I really like this doctor. And we'd have some of them actually switch out of that plan so that they could come and see us. And that happens when you provide a service that they want to get, right? And that goes back to, how did we learn all of this stuff, and how did we get to this point this many years later? And that's kind of like my number 3 of the 4 of the top 3 things, my top 4, trying to be funny here, but is I think when you run a small business or you go out on any endeavor, you really need to focus on and write down getting good at discovering the things that you don't know that you don't know. That, especially in medicine, can be a dangerous thing, right? And my fellows and my residents, first off, they tell my fellows, I say, every mistake you're about to make, I've already made, right? And what I'm saying to them is, look, you're going to make mistakes, right? It's okay. That's part of how we get better. Okay. But having me as this mentor sitting over them and trying to teach them how we do things, I think inviting them in to say, look, it's okay if you make a mistake, but you need to learn from it, right? So recognize it, don't try to hide it, and learn from it, because that's how you get to a certain point. But the bigger thing is if you want to mitigate or reduce the number of mistakes you make in any business, in medicine in general, or in life, part of your search should be finding out the things that you don't know. And that usually involves talking to people, right? That involves networking. That involves asking people. That involves asking a lot of questions. When I left my last practice to start my own practice, I had no idea how to set up a corporation in Illinois. I had no idea, how to open up a corporate bank account. I had no idea how to sign for a corporate loan. I had no idea how to run a payroll. I had no idea, how to do a P&L. I had no idea what EBITDA meant. I mean, there's all of these things that I had no idea that I needed to know these things, but I knew that I didn't know a lot of stuff. And so I started talking to the people that did. And what you'll find in the small business community is most of us are more than willing to take time out of our day to help our fellow small business entrepreneur, because that's it's almost like a biological evolutionary thing, which is how we survive. The more we talk to each other, the more we share ideas, the more we explain to each other, like, hey, this is what I did for this problem, the better we do as a group. And the better we do as a group, the more likely it is that these businesses are going to succeed. And that's what kind of begets the next level or the next project or the next venture.
Or or hire a consultant, hire a coach.
Right. Well, that's asking, right? I mean,
exactly.
Sometimes you pay for the expertise. I mean, we do it all the time, right? I mean, we pay lawyers for their expertise because they set up our businesses. They deal with all the legalese stuff that we need.
And right? then it's done. And the business setup's a great example. I've owned 3, and I've incorporated, I think, 1 by myself, and right. one I bought, and then when we paid. But if you pay, it's just done. You sign the documents and it's done, and it frees you up to do the other things that are making you money. But it's I always say it's like getting the wheel. You go buy the wheel and you start rolling, instead of having to figure out how to make someone else has done that. Just go buy the wheel, plug it into your business, and get going. In our brick and mortar business, I hired a consultant, and I 4 to 6x my monthly service revenue. And it was a matter of we had the pieces, but I didn't know, to your point, I didn't know what I didn't know. And there were 2 dots, and we just had to connect them. Right. And once we connected them, the revenue went like this. Mm-hmm. And I had no idea, but somebody else did. And they're like, yeah, look, this and this, draw a line, boom, done. And I was like, whoa, really?
That story segues perfectly into my 4th point, my 4th kind of thing you need to do, which is, and I don't think that this is not anything that anybody who's listening to this hasn't heard before. I put a little bit of a nuance to it, but everybody talks about, well, if you're going to have your own business, you just got to be willing to work long hours. You got to put the time and the hard work in. And that's true. But I think there's another way of looking at it, which is there's no substitute for long, efficient hours spent on your project. And what that means to me is kind of what you said, like, I remember for years and years and years, I did my own taxes. Nothing was really that complicated. I didn't have tons of streams and stuff. I mean, now I have, I have the practice, I've got the device side of things, I have a consulting business on the side, I've got all these things going on. And I remember I spent like, I want to say like almost 4 weekends doing nothing but trying to figure my taxes out. And my wife was like ready to kill me. She's like, my God, like, and I was in a bad mood and I was getting tired of it. And it was just like, this is crazy. Cause I was always of the mindset, well, I just got to go to the IRS website. I can read about it. If you got reading comprehension skills, you just read about it and then you apply it. Right. And if you do that enough times, you can get good at anything. But what it boiled down to, my wife said, listen, man, she goes, why are you doing this? How much money are you saving by not just paying an accountant to do this? And the light went off for me. I was like, yeah, you're right. Like I probably would have been better off paying an accountant and extending my hours by a third of what I spent trying to do my tax.
Right.
And I would have paid for the accountant and then some. And so when I talk about working hard on something, when I talk about putting long hours in, they can't be just I put the hours in and so it should just happen, right? They have to be efficient, productive hours. And I think people that have their own businesses, I don't think this is unique to me by any stretch. One of the common threads I see across all of my friends who are entrepreneurs, all my friends who have their own businesses, is they're very efficient with their time management, and they're very wise about, and not maybe not in the beginning, but as you grow and as you get better at it, you become very wise about the things that you should spend your time on against the things you should spend your money on. And I think understanding that over time is important, because that goes back to that work-life balance, where if you hate your job because you're doing these things that you're not good at and they're bogging you down, it makes it no fun. And I tell my employees this too, which is, my employees come into my office and they're expected to learn how to take certain views of x-rays and things like that on our digital x-ray machine. And I try to preach, well, listen, practice, ask me too many questions. But really what you want to do is you want to get so good at this that it's second nature to you, that it's like, it's not difficult. You're getting the right views, you're snapping the right pictures, you're giving us what we need. We're not having to re-image and things like that. And I said, and that's just one example, setting up a procedure or doing intake or whatever. Because once you do those things efficiently, once you get good at it, then the job becomes fun, because then it becomes, you have more time to talk with the patient or the customer and get to know them and tell stories and make jokes. You have more time to connect. You have more time to deliver the service that you want, because I think anybody at any level feels good if a person comes into your world sphere and you have the ability to help them in some way. And it could be something as simple as, helping a little lady put her groceries from the cart into her trunk, right? I think you got to be kind of a psychopath if you do something like that and that doesn't make you feel good, right?
Right.
And that's what a lot of businesses are. A lot of small businesses, especially in a capitalistic society, it's someone gets out of bed and they're like, I want to give to Ray something that he wants, that he likes, that I can produce. And if my staff is really, really good at their job, and then they can give that customer service experience with those my staff, I get compliments on my staff all the time. Now, none of us are perfect. I mean, we always can do things better, and we all know that. But when you hear, patients say, doctor was great and the staff was top shelf, the staff was really good and this and that, I think that that's something that gives them pride of ownership of being a part of that entity. And it's not necessarily that it's my practice or it's the practice. It's the fact that they're involved in a job where they're providing a service that people want and they're doing it well and the people are appreciating that. And I think that brings gratification to the job. And so spending your time efficiently and being good at it is one of the biggest things to me.
And it's funny, but that same thing was shared we did a podcast and a webcast with a GM of a large big box home improvement store. And he had said that, like, when he takes over a store, one of the things that he needs is, he's like, I need everybody and it could be 100, 150 employees. He's like, I need all of them to buy in on the mission. Right. And the mission, I've got my mission and objective, which is typically sales driven, but for them it won't be. But I need them to have buy-in, and I need them to feel a part of what we're trying to do. And kind of exactly what you said, they need, and once they start having some ownership, they start to enjoy the job. They're proud of the job. And the result is they end up doing the job better. And it's not like he said it's not like he's trying to get them to do things they don't want to do. It's, in his words, he's like, I want our customers to walk outside of the car, outside, sit in the car and say, wow, what just happened? Like, I want them to be like, I was shopping for home improvement stuff and that was a great experience.
Right.
And if my employees have the buy-in and feel a little bit of an ownership, we're going to have customers going out in the parking lot with that wow experience. And that's exactly what you're saying.
Yeah.
Because once the staff is to that point, they're happy to be there. They're doing a good job. And the result is you have happy patients.
And I think you can apply this, a lot of the things that you can apply to small business, you can apply it to life, which is, it's funny how these things run in parallel, right? Because I think good sound principles are good sound principles. And I think no matter what you do for a living, if you feel like you're sharing a piece of yourself with another human being and you're helping them with their issue, whether it's, they got to find the right tire to put on their car, or they have a pain they're looking to get rid of. And whether you're the guy who makes the tire, or you're the guy who puts the tire on, or you're the guy who looks up and figures out it's the tire that they need. I mean, everybody has a piece of that role to produce that product, which is, in one case it's a tire, and in another case it's a satisfied, healthy outcome. And I tell my staff, anybody who works for me, I tell them, this is not a bank job. This is not a 9-to-5 job. And I'm not knocking anything against anything. I'm just saying, this is what it is. I mean, I'm very clear about what I say and what I mean, which is, I might say this is not banker's hours. We take care of people for a living. And again, like I said, people don't take federal holidays. Their illnesses don't do that. And people's illnesses don't shut off at exactly 5 o'clock every day. And if that's something that you don't want to do, right? If you don't have a bigger urge to take care of people, if your goal is to get get off and be out the door at 5 o'clock every day, then this might not be the right line of work for you. And this is something that I think you can apply to anything. And in my world, and I think this is the lesson to the small businesses, when you start staffing that business up, being honest with your potential employees about what they're getting into. Just like with my patients, I try to be very honest about what I can deliver for them. People have come into me and they think, I read about this surgery in the Wall Street Journal or something, and you go, well, yeah, but it's not that simple, right? You don't fit this mold, or it's not as simple as the way it was presented in the media. And so you want to temper and give correct expectations so that when they go, okay, this is what it can deliver. Because there's nothing worse in the business world with selling somebody something that they think they're getting something that's amazing, and it turns out letting them down, right? So and I guess the saying is under promise and over deliver. There's nothing worse in my world than over promising and under delivering. And so I would rather somebody walk away from a surgery when I sit down at that consent and tell them these are the potential risks of this procedure. First thing I tell them is, any surgeon, whoever tells you they never have complications, you can't trust the next word that comes out of their mouth, right? Because I know some of the best surgeons on the planet, and we all go to the same conferences, and we all share complications. We all try to figure out how to get out of them. We all try to figure out how to fix them. And we all try to figure out how to avoid them in the future. Some of them are just purely unavoidable. A real life example is when you try to fuse two bones together in the foot. There's a specific joint. When you look at all of the literature across the board, and it's all the different surgeons, all the different patients, all the different studies, there's a 15 to 20% non-union rate, right? Which is 1.5 out of 10 patients, for no good reason, their bones aren't going to unite the way that they physiologically should. And that's medicine, right? That's just in my world. There's other types of medicine. There's cancers, obviously. There's realities that set in, and you have to present that reality to the patient, just like you have to present that reality to your employees, which is, this is what we do for a living. And if this isn't the type of cloth that you're cut from, you probably don't want to work here.
And it's so valuable for the business owner to do that on the front end.
Absolutely.
I used to tell my staff, I worked when I was sick and I worked when I was tired. Now, if I had a contagious something, I wasn't going to go into the office per se and spread it around and give it to everybody, but I probably worked from home, and I expected the same of the staff. Like, we had a job to do, and it's going to get done. And if you're not, if you want to make sure you leave work exactly at 5 o'clock, same deal. This probably isn't a good fit. And it's far better for the business owner to decide that on the front end. And I explain it to people I work with that I'm like, listen, as the business owner, it's your bus. You need to understand who needs to be on the bus and what seat they're on. And onus is on you to make sure that first, the wrong person doesn't get on the bus. Because if the wrong person gets on the bus, then you got to get them off the bus. The second thing is you need to make sure that when they're on the bus, they're in the right seat. That's on you. And if you don't do those things on the front end, it's costly down the road, because now you have to document and make the case to potentially fire an employee. You're going to have to hire a new employee, gamble that they're a good fit. You're going to have to train them. And all of this time means resources are diverted from generating revenue. And that's huge. And I think a lot of business owners, it takes them years. It took me years to realize, like, my most expensive thing in my brick and mortar business was employees. And it wasn't the cost of the payroll, it was the cost of time, energy, and effort to attract the right talent, retain the right talent, train the right talent, and then when they were leaving, replace them with the right talent.
Right. Yeah. I mean, and that's invaluable. And understanding that, a lot of us, we learned that either we were lucky and someone mentored us and gave us that tip right off the bat, and a lot of us learned it the hard way. And so the other side of that coin too, right, Ray, and you know this as well as I do, is sometimes the business will get stuck, with maybe like a highly skilled employee or somebody who has a lot of responsibility, and you, as the owner, you start to become convinced that you can't do without them, right? And I've had several situations over the years where I've had that employee, but then as we dug deeper, there were some serious flaws in the employee's performance and things like that, and we were not willing to see it because we thought that these other things were too valuable. And the thing I've learned is that every time I've made a decision, every time I've made a change for good reasons, not you don't make changes for bad reasons, but every time you've made a change for a good reason, the business ends up for the better. And I don't know why that happens. I don't know how that happens. I do know that every doctor I know that I'm friends with who has their own business, we talk about this all the time. And we talk about how you got these employees that you perceive as just irreplaceable. And that really isn't the case. And I think that a really good business, right, and this would be something in my world as a marketable business, is something that would be able to be sold and monetized, is if I created a business where even I was replaceable, right, where I could remove myself from the equation and plug in another person with similar credentials, and the machine still runs the same way. I think with medicine, it's a little bit more different than setting up a factory and building widgets, because there's so much humanism involved in it. But that would be the ideal goal, right? Which is you build a machine that literally doesn't need you there to make it work. And that's putting in good process. And that's listening to all the things we talked about, which is taking the feedback and making the adjustments and learning from the mistakes and putting the product over the money. And making sure you're constantly searching out the things you don't know. And as all of those things start to come together over time, with all of that hard work you've put in, that efficient hard work, and learning what's efficient and what's not efficient in your world, to me, that would be sort of the ideal business, which would be one where I could literally step away and tomorrow the thing wouldn't miss a beat.
And that's where, having a principle that guides the business, which is we're going to deliver the best result in your case for the patient. So if it's not contributing best, then we need to evaluate why we're doing it, not do it, and do what delivers best. And then also having systems, and that employee, I think business owners, and I know I did, you get comfortable. You have someone that you think, well, I really can't replace them. And then you're comfortable and you're like, and on top of it, even if I try and replace them, it's going to create more work for me. So I'm just going to leave them.
Right.
Well, inevitably that just costs money, and it costs you customers, and really it costs relationships with customers, because we're no longer putting that best customer experience first. We're putting an average employee in front of our customers, which we should never do. And it's hard to be willing to get rid of those people, and it's hard to get them off the bus sometimes, knowing that it might take me a while to get them on.
If they're toxic, I agree. I think you should never allow an employee to have a toxic effect on your product, whether it's the patient experience or the widget you're building or whatever. But I do think that there's a point, and I think this comes to, like, you kind of say that I say this to patients, and I know that this is sort of a business model too, which is, a patient will come in and say, this hurts, and I had 3 previous surgeries, and it still hurts, and okay, well, here's where you are, where do you want to be? Like, what's a good outcome for you? I mean, I asked them this point blank, and you'd be surprised that patients who are not terribly sophisticated in medicine, but they'll give you real world answers of, like, what they want to do. I just want to be able to walk my dogs, or I just want to be able to play around at golf or something like that. And then there's 2 things you got to do. At least you got to scale back the expectation if it's too much, right? Or you have to reinforce and say, okay, yeah, we think we can do that. But once you kind of know where that end goal is, then you can kind of create the path going forward. There is a thing, I think, with small business, which is, are you building a business to sell it at a multiple, right? Are you building a business to try to sell it off, to exit it, or are you building a lifestyle business? And I think there's a distinct difference in those 2 things. And I think in the lifestyle business, it's okay as long as it's not toxic, to accept the fact that people are human, and they're probably never going to be 100% what you want them to be, and that you don't need to just constantly crack the whip and drive for that, especially if if that means spending your weekends and your nights, trying to perfect that machine, and now you're missing out on family time. Your kids are growing up, you're not seeing your friends, you're not enjoying some of the fruits of that labor. I think that you got to be careful not to fall into that trap, because I do have friends who are so intently focused on their business that it's like everything else just melts away, and that's all they do. I mean, I got a guy right now, I could call him at any hour of the night, and he's going to answer the phone, and I'm going to say, what are you doing? He's going to be like, I'm looking at codes, or I'm researching this, or I'm doing that, and it's like, I get it. I don't, to each his own, but I don't know that everybody wants to have a small business to do that. I think some people want to have a small business to feel like they go to work every day doing something they love. And if there's some imperfections in there, as long as they're not destroying the brand, you don't have to act on everything, because then it's that bird flying to the worm thing again too, right? How much energy are you going to put in?
Right.
Are you just going to replace that person with someone who's, are you going to put in like 80% effort to replace that person with someone who's going to make a 5% difference? And I think that that's something you got to think about also, which is sometimes good enough is good enough. We have a saying in the OR, right? The enemy of good is better. So, the human body has an amazing way of healing itself. And that's why when you look at like traumatology and fracture care and stuff like that, there's certain angles of bones that you'll accept because the studies have been done, and they say, look, it's not worth creating this much more surgical trauma on this patient's leg or arm to get another degree of correction.
There's not enough return.
Yeah, when functionally speaking, there's going to be no difference in the outcome, right? And I think that that's something that we apply scientifically. You're an engineer. You probably think about these things the same way I do, which is we apply this scientific question and answer to everything, which is, what's the energy in and what's the benefit out?
Yeah, what are we going to get for it?
Yeah, and sometimes with human resources, I think you just have to realize that because it'll drive you crazy if you own your own business. The one thing, the people who work for you will never see your business the way that you do. Right. And I don't mean that as a slam. I mean, when I worked for somebody else, I never saw it as mine. Right. It was a job. And like we said earlier in the program, some people just want a job. They don't want to have to think about the things we're talking about.
And
But you can't
that's a
expect those people to think about your business the way you think about your business.
yeah, and you have to get over the fact. I know I struggled with this. You know, I had 12 or 14 employees at the time, and I remember like literally banging my head against the wall at night after I was already home, trying to figure out how can I get them to do this? How can I get them to do more? How can I get them to take it serious? I even flat TVs had just come out, the big heavy ones, like the plasma ones. They were really expensive. They were really heavy. Not everybody had them. It was a big deal. So I had created a contest for my staff, and I had said, you know, whoever wins this is going to get the TV. And the contest was all me getting them to be more like me.
Right.
And at the end of the day, I never bought the TV because nobody won the contest, because nobody was going to be me but me. It wasn't their business.
Right.
And that's when it finally clicked for me. It's like, well, geez, I can't ask. They're not going to see it my way. It's not theirs.
Right. And,
okay,
and you know, the funny thing is if I know some of my staff and they know that we did this, they're going to listen to this. Right. And so I want to tell them right now, this doesn't mean you get to come in on Monday and slack off. Okay. That's not what we're saying. Right. We're saying, what we're saying is we expect everybody to put their best effort in. Right. And understand that as long as that best effort is getting the job done to a point where it's not toxic and it's making everybody happy. I've just never had, and this may be right or wrong, and I'll bet you there's people who you're going to interview who completely disagree with me on this. I've just never had that urge to squeeze every penny out of the machine, right? Because to do that, it starts to disrupt that work-life balance. And I know people that do, and I think they have a different goal. When you look at the device side, look at the device business that we started, it was a different animal, right? Because we were building something. I mean, you know, my Ken Gall, who's the head of mechanical engineering at Duke University, who's, you know, one of my fraternity brothers, and he and I are the two original founders of MedShape. He was never going to leave his academic career to run a device business. I was never going to leave medicine to run a device business. And the people that we took in our friends and family round of investment, you know, they didn't want to just collect dividends of this machine for the rest of their lives. So you run that business a little bit differently. And so looking at what you're doing and why you're running it and what you want to do. I mean, my wife and I take a lot of pride in the fact, and our ops manager has said this, you know, we try to run like a family style, a family atmosphere. Our employees, I had it audited by my accountant years ago, and generally speaking, he said that my employees enjoy working for us, and we're very lenient with them. We know life happens, and we understand that, you know, sometimes they need a day off and this and that. And we've had we've had employees, you know, leave to go to another, you know, a big corporate box place for $1 more an hour, and then they realize, wow, you know, you call in, you get 3 sick days, you call in the 4th day, you're fired, you know. You don't get to leave early. You don't get to have the benefit of the doubt that you do in a smaller family style business. And so that's just something that my wife and I decided a long time ago that we wanted to do. And to the point where we don't have Saturday clinic hours. And some of the patients get upset about it. And they're like, look, you know, I work Monday through Friday. I would like to come in on a Saturday. And I go, look, I work Monday through Friday too. And I want time with my family. Because not only do I work Monday through Friday, but I answer the phone at 9 o'clock at night, 10 o'clock at night, 3 o'clock in the morning, Saturday morning, Sunday evening. You know, it's if I allowed the machine to become sucking every dollar out that I can, I think that would ruin my passion for it, and it would ruin my love of it, and I wouldn't do it as well, and that might in turn turn around and harm my revenue.
And there's no might about harming the revenue. It would have a direct impact on the quality of service and that customer experience. So instead of putting the best patient result first, you would be putting dollars first, which would compromise the patient experience. And it wouldn't happen immediately, but it would start to erode some of your profitability and your top line revenue. I'd be shocked if it didn't.
Yeah. I mean, you know, and the funny thing is this podcast you have is great because people can log in, and it might even seem like I'm looking at like, is this very interesting to people? Well, if you're going to start a business or you're trying to run a business, it should be interesting to you. When I was in residency, I was known as the guy that was always at the hospital. I mean, even when 5 o'clock rolled around and we could take off, I'd go peruse the board and see if any emergency cases or traumas or anything were coming in that I could learn from, because I had this very acute awareness that like, this is my time to learn from other people, right? I only have a finite amount of days that I can sponge off of somebody else. And then one of these days they're going to kick me out of the nest and I'm going to own every single problem that walks through the door. And so I think if you are that person, people that are successful in business are those people that go, you know what, I'm going to take every opportunity I can to learn something new, even if it's not in my field. Like I would scrub back cases, I would scrub lung case. I mean, I would scrub any surgery that I could.
So for people that don't scrub means that you would go in and be present for surgeries that aren't in your normal field of practice,
right.
So you can learn something different.
You gown up sterilely, you get into the field and you assist, you help, the attending surgeon either lets you do nothing, they let you do something, they let you, it just depends on the relationship. It depends on how much you earn the right to do something. But what I learned was there are things that I learned in off-service rotations, like general surgery rotations, that I use in my field that I would have never learned if I didn't venture outside of my field. And that was just a matter of just wanting to collect as much knowledge as possible and worrying later about whether it was useful or not in that environment, because I only had so much time.
And that's kind of, that's the why of these webcasts and podcasts is, and it's not going to be for everybody. Somebody that has no interest in being a small business owner or entrepreneur or working for themselves, that this will be a complete waste of their time. They'll have no interest. But that being said, for the individual that recognizes, hey, I want to try and do this, it's gold, because you can take what, if you're listening or watching, you can take the things Doug has said. And if you're not doing some of these things, and you don't have to be in the medical field, you could be in the home and garden space, you can be in the home repair space, you can be in the automated billing for whatever industry space. You can implement some of these things in your business today, and you will probably be more profitable. Your top line sales, total sales will go up, and you'll probably have more free time.
Yeah. Why should anybody listen to me? I don't know. I've just been doing it for a while. And I think you're the resource here. I mean, you have such a Rolodex of people who've been doing it, been there, done that, made the mistakes, learned from them, share that. I imagine a world where this becomes enough of a following that if someone stumbles across this and listens to one of your podcasts and says, oh, I'd like to know more about what this guy was saying, the big box store guy, like, hey Ray, can I reach out to you to get more information or to maybe get networked with this guy, or I have a problem that I need some counseling on or something like that. I think that's the bigger value, because think of it like this. I mean, a library of podcasts is just an encyclopedia of knowledge, and it might not necessarily be world renowned business leaders on the stock exchange or anything like that, but small businesses tend to not be that, right? Small businesses tend to be the opposite of that. Small businesses are not getting out of bed every day and worrying about maximizing price per share and doing, and making the stock prices rise and all that other stuff. So it's a different animal. And there's not a lot in the Wall Street Journal all the time about things that we need as small business owners. And so it's always been a more tight-knit community. And the reality is it's not even a small community, right? I mean, the vast majority of employers in this country are small business owners.
Pretty much. I mean, you can pick the trades, plumbers, carpenters, remodeling companies, general contractors. It's all small business. I don't know what the SBA current dollar amount is, but I think small business is defined up to like a few $100 million in sales.
And it's really, and the other thing too, Ray, I'd say, and I'm, I gotta get off here a little bit. I'll be happy to come on again to talk devices with you, but I gotta run to a lecture that I gotta give. But I'd like to end. I think the biggest thing is that I don't think the culture teaches the small business entrepreneurship as much as it should, right? When you go to the high school counselor, it's all about getting good grades and getting into a good college, getting a good degree, and working in corporate America and working your way up the ladder. I really feel like as Americans, me as an American, being grateful for having been born and raised and being able to live and grow up in this country, entrepreneurship is something that we are bar none the best at, and we're not teaching that for some reason. And the reality is I tell everybody I can that, hey, college is fine if you're going to make use out of that degree, by all means. But I do think it's overpushed, right? There is nothing wrong. And I told you I come from the trades and blue collar background, and so I'm about as blue collar of a surgeon as you would meet. But there is absolutely nothing wrong with learning a trade and starting your own business around that trade, and working that business and working it hard and working it successfully. And I'm going to tell you right now that the guys that do that, they have houses on the blocks in the neighborhoods with the doctors and the lawyers. And it's just a matter of having the initiative and learning the know-how of doing it for yourself, so that every ounce of effort and work that you put into it, you're doing it to build your brand and to build your vision of what you want that machine to look like.
And we don't talk enough about starting a small business. We don't teach our kids that. And even I've got a client that I consult for, and one of the things I've done is built a customer retention system. And part of that system is a follow-up with customers 30 to 60 days after their purchase, we'll call it. And I happened to chat with one of their customers while running the system this week, and it's an individual that you never would guess has made a lot of money. But this individual has like 6 or 7 drag race cars, and just his motorhome that he hauls his trailer with his cars to go racing, it's almost $500,000 motorhome. And if you looked at what his business is, most people would think that individual really doesn't make any money. They would think that to have the money he spends on his hobby, he would be somebody on Wall Street and in big corporate America. And actually it's the opposite. Like, if you were to talk to him about his business systems, he could teach people a lot about business, probably more than many MBA programs can teach. And when you look at his industry, you think there's no money in that. Yet when you look at, that's just his hobby. I mean, he's probably got $2 or $3 million in his hobby.
Right.
And it works, and he knows something. And that's like the goal of these webcasts and podcasts. And what I'm trying to do with Small Business to Grow is to grab individuals like you, where, okay, he's a doctor, and we do need to we can cut this off today. We do need to talk devices, but you weren't taught business in medical school. You were taught to practice medicine, yet here you are, you got a business, and you've started a number of other businesses. Like, your story is of value. Somebody that wants to be a business owner can take 1 or 2 of these nuggets and plug them in today. Same thing with the guy that I was just talking about. Somebody can chat with him for a few minutes and learn 1 or 2 things that he's done in business, or hear a couple of his mistakes and go and plug it right into what they're doing. And it's going to work. Even though it's not the big Wall Street Journal, it's not the story on page 3 of the Journal. It's not being covered on TV. It's not this big showy publicly traded corporation, but these are real people getting it done, and in a big way.
Yeah. And they're pursuing their passions. It's when you look at, like, and by no stretch of the imagination should material wealth be the end goal for anybody in life. I mean, I'm a firm believer in that. I mean, there's a documentary that I recommend to everybody, and it's called Happy, Happy, and it used to be on Netflix, then it was on Amazon. I don't know where it is in the cloud at this point, but it could be found. It's as simple as the word Happy, Happy. And basically what it talks about is, how much money do people need to make to be happy? Right. And I think when you look at someone who's got like massive wealth, like an Elon Musk or a Jeff Bezos or Steve Jobs or Bill Gates, you can go down the list. Right. I don't I don't suspect that many, if any, of those guys got out of bed one day and said, I'm going to do whatever it takes to become a billionaire. Right. I think what happens is they find something, they find a niche that they love, and they want to do it well, and they want to work hard at it, and then they want to own it. And then it just takes on a life of its own. And it takes on a life of its own because of how they run it, not because the end goal was to be rich, but the end goal was to produce a fantastic product. And you can do that with anything. And whether that's a service, whether it's a widget, it doesn't matter. If you hold the standards high to producing the best product, you never know. You might be the next person who is on that list of billionaires. And so I always encourage people to try to do that and just to follow their passions. Now, there's obviously, like your one guest said, I mean, there's some things that are really silly, and that goes back to seeking truth and not being right. You can't, you got to make sure that your passion is something that either the public wants or they just don't know yet that they want it because they haven't seen it, right? Most of the things that disrupt the business world create a market. They don't just go in and try to take a piece of the pie of an already existing market. They try to create a market.
Right. They don't Me Too it. That's, the iPhone.
Right.
We didn't think we needed an iPhone. We all had flip phones.
I thought that was the dumbest thing when I saw the first iPhone years ago. As one of my residents had it, and I said, "What is that?" She's like, "Oh, it's my little iPhone." And she showed me, I was like, "Oh, that thing looks complicated. That's stupid." And now it's like, what do you do without it?
Right.
But see, I don't think like Steve Jobs, woke up one day and said, "I'm going to make this thing called the iPhone because that's going to make me a billionaire." I think his principles were in place. I mean, if you think about what the iPhone does for you, right? What it is, it's your personal assistant. It's your means of communication. It's a way of looking up recipes. You can watch stories on it. You can listen to podcasts. You can do all these things on it. That's the principle behind it. The actual phone is just the ideation or the mechanical ideation of that principle. And so no matter what you do, and you could say this about being a plumber, right? Or carpenter. What do you want to do? Do you want to build things? Then build things. Just do it well and do it for yourself. And then when you employ people, try to have them buy in, like you said, to the mission and buy in. You want to build a business that people want to be a part of, so they can be proud to say they're a part of it. And that's in the end, I think, everything we just talked about, and why somebody would listen to me. I mean, I'm a relative nobody in the business world, right? But I do have a small business, and I think most people who have small businesses who share the same values, they would consider themselves relative nobodies too, because that's by definition, we're small businesses. Wall Street doesn't care.
And that's where I think there's so much value is, yes, we may be nobodies. We may not be on the business network or in the Wall Street Journal, but some of us are successful. And if we can do it, someone else can do it, and maybe they can do it twice as well. And it's just sharing those stories. Well, we'll wrap up. I know you got to go do a lecture. Doug, thanks for your time. We appreciate it. I do want to do a recap on the top 3 do's and don'ts, and we can do that next time, unless you want to do it now.
I can do it right now. No, I can do it right now. So, I mean, I give you 4. I give you 4. Sorry. I mean, if you get,
that's all right.
That's sorry, but under promise, over deliver kind of
a 4 don't do's.
The 4 don't do's?
Or do you do 3 don't do's?
Oh man. The 3 don't do's. Don't repeat the same mistakes over and over again, expecting a different result. Don't look at your customer, or in my case, your patient, as a dollar sign walking through the door, right? It's very easy to understand that. If someone gets the sense, people have better senses than you think. If they feel like everybody's had this experience. You go somewhere, there's a reason why we call it the used car salesman. I'll tell you a really quick story, and I'm running out of time, but I remember going to a Best Buy one time, and I went in and I got this kid walked up to me, and I said, "This is what I'm looking for. I'm looking," and I gave him very specific dimensions about what kind of a television I wanted. And he immediately just took me to the television place and started showing me the biggest TVs. Like, it's like, yeah, okay. And then he just basically it was like, no. And he just kept going down the line, most expensive down. And I was like, I'm not buying any. And I saw the TV that I eventually wanted, but I didn't buy it from him that day because he upset me. I was like, you didn't listen to anything I told you. and you're trying to sell me what you wanted to sell me. And I had that same experience at a car dealership when I said, look, this is the type of car I'm looking for. And he just showed me what he had on the lot, tried to make that square peg fit the round hole. And he was more interested in making, so those are people that were looking at me as like a dollar sign. And I didn't like that feeling. And I don't think anybody likes that feeling. So that's number two. Don't look at anybody who walks through your door as the dollar sign. Give them the service first so that they're happy to pay you for it. Right. And number three of don't do's, don't give up, don't quit. Don't let yourself convince yourself of all the reasons why you should not take the risk.
Cool.
We want to go to the 4 do's again? Is that what we're doing?
Yeah, go over your 4 do's.
So again, just, seek the truth over being right. It's more important to discover truth than to be right all the time. And it's absolutely okay to be wrong, as long as people understand that you make mistakes. And what's more important as a human being is being able to recognize that and remedy that. Put the service or product over the money. In my world, it's called good medicine is good business. Get good at discovering the things that you don't know that you don't know. A little bit of a tongue twister there, but those are the things that will sink you and blindside you. And number 4 is there's no substitute for a long yet efficient hours spent on your projects.
Awesome. Well, Dr. Doug, thanks for your time. We appreciate it. Smallbusinesstogrow.com. If you'd like to learn more, subscribe to our channel, subscribe to our podcast, swing by our website. Lots of great information from other entrepreneurs, small business owners. Take their wheel, put it into your business, get rolling.